Hello, Dr. Taft with Foot and Ankle Associates of Southern New Hampshire, and we're back for our third and final installment series on hammer toes. So we've touched on what a hammer toe is, how you identify them, what some of the causes can be, and we'll finish things up now with treatments for hammer toes. So most hammer toe treatments are centered around conservative therapy. So when we talk about treating them conservatively, we're talking about trying to accommodate the deformity. So a lot of pain that comes along with a hammer toe is due to just the way the toes are rubbing or causing friction on shoe gear or with certain activities. So initially we try to tell patients to accommodate them as best as you can. So inspect your shoe gear, make sure that you're wearing something that has a wider and a deeper toe box to give those toes plenty of room to move around. You're not going to eliminate all the friction and rubbing, but if you can eliminate a lot of it, then it can make them much more tolerable and easier to deal with. We have pads and cushions and spacers. You name it, you can Google stuff and find pages of other ways to try to pad them and cushion them. Some of them work better than others, but there certainly can be little devices that work pretty well, especially if you're going to be wearing a particular shoe that you know it rubs. If you wear something that might help to alleviate some of the pressure and the friction. None of these devices are ever designed to correct. So using a hammer toe splint or trying to tape it or strap it is never going to correct the deformity. All of these things are just based around trying to accommodate it or make them more comfortable. Okay, so we do that as best as we can, and in those cases where people just fail conservative management, padding and cushioning isn't working, they can't get shoe gear to fit well, they're just struggling to be able to get through day-to-day activities, then that's when we start talking about surgical correction. And the idea behind the surgery is to straighten the toe. And there are lots of different methods and techniques nowadays to do this. Traditionally, the standard treatment would be to go in, make a little incision over whichever joint is bent, and we remove little pieces of bone which allow us to reposition the toe straight, and then we generally would need to fixate or hold that bone in that new position, and that was generally done with a little pin or a wire that would extrude for the end of the toe. We have other techniques where we can implant something into the toe now to keep it straight, so you don't have to have things sticking out. There are a lot of other minimally invasive techniques that we can do, whether it's soft tissue balancing, that doesn't always require a lot of bony work, but basically we're just trying to reposition, rebalance, so that the toe is sitting out straight and that you don't have anything that is now prominent and causing rubbing and friction on the shoe gear. So there are surgical options. There are a number of them out there. There seems to be something new, every few months that's groundbreaking. But again, surgical options are available and depend largely on how well conservative management has worked for you. So, all right, so that's kind of wrapping up our series on hammer toes. Certainly, we encourage you to share these videos, like the videos, give us a call at the office if you have any questions about anything, or certainly feel free to come on in if you have any questions or concerns, and we'd love to meet you or see you and take a look at things and see what we can do to help. Thanks again for watching. Appreciate it. Bye-bye.